this is in the Seattle Times, Marybridge Children's Hospital to close gender clinic. So this is published on January 27th of this year. This is here in the Puget Sound, west of the Cascades, on the very, very blue part of Washington State. And just a couple of paragraphs here. Marybridge Children's Hospital in Tacoma plans to shut down its gender clinic this week under mounting federal pressure to ban all gender-affirming health care for trans youth. Hospital leaders announced the decision in a Monday memo to employees, writing that, quote, recent developments at the federal level threaten to halt Medicaid and Medicare programs payments to the entire multi-care health system, which owns Marybridge, if it continues to offer gender-affirming health services to minors. This was an incredibly painful decision and one that I wish we did not have to make, Multicare's CEO Bill Robertson wrote in the memo, which the hospital shared with the Seattle Times. We recognize how important this care is to our gender health clinic patients and have a sense of the impact this will have on these patients and their families, end quote. But without federal Medicaid and Medicare payments, Robertson continued, quote, our organization would cease to exist, end quote. According to the hospital, more than 60% of all Marybridge patients rely on Medicaid, known as Apple Health in Washington. Marybridge cut its gender clinic waitlist of about 150 families in September, confirming then that the clinic would continue to serve those who were already receiving gender-affirming medication, like hormone therapy and puberty blockers, but would not start any new medical treatment. This week's news means cutting off care to the clinic's remaining patients, roughly 320 young people, including 180 under 18, who will now have to get their prescriptions renewed or find gender-affirming mental health care elsewhere. And it goes on. You know, the language here is insane. Gender-affirming healthcare, gender-affirming medication. No, at best, fantasy-affirming medication. at best, right?
Yeah.
Mental instability-affirming medication. Celebration of mental illness medication, right? That's what they're not going to be doing for these many children and other young people anymore, but only at this point, end of January, under duress from the Trump administration, from the federal government, who said, we're going to cut off Medicare and Medicaid payments unless you cease and desist. You got to stop. So if I can, maybe we can just go right here to then this week, just yesterday, I believe, February 3rd, we have here the American Society of Plastic Surgeons makes a position statement. It's the ASPS, the very first major medical organization, and it may just be the very first medical organization, full stop, to put out a position statement on gender surgery for children and adolescents, the summary of which is, the clinical management of children and adolescents presenting with gender dysphoria or gender incongruence has undergone rapid change, and ASPS, again, the American Society of Plastic Surgeons, wishes to offer guidance to members providing gender surgery services for this population. This position statement discusses the views of the American Society of Plastic Surgeons on breast, chest, genital, and facial gender surgery for individuals under the age of 19. Funny, the summary doesn't say what their position statement is. They're still hiding. They're still hiding here, but you have to scroll, you have to scroll, you have to scroll. Caveat after caveat after caveat, hiding behind what they've already said, explaining why they didn't come to this sooner. Finally, the ASPS position. ASPS recommends that surgeons delay gender-related breast, chest, genital, and facial surgery until a patient is at least 19 years old. It's too little too late, but it's utterly necessary, and it's about time, right? It's like the changes to the childhood vaccine schedule. Oh my God, we got a lot further to go, but good. They're making no statement. They're the Association for the Society of Plastic Surgeons, so maybe they wouldn't have any say about the endocrinological interventions. But with regard to surgery, which is, after all, their bailiwick, they're saying until you hit 19, until you hit 19, you shouldn't have facial feminization, or I guess masculinization, but I've never heard of that happening. Maybe that happens. Although that would be an adding rather than a subtracting, so that's not as easy to do. Genital or top surgery, when it's called top surgery. So again, too little too late, and they hedge and they hedge and they hedge and they explain themselves away, about which I have very little patience. But they ultimately get there. And then in the wake of this, if you can show the national review in the wake of this ASPS position statement, asked the AMA what they thought. And the AMA, the American Medical Association, said in a statement in National Review that because, quote, the evidence for gender-affirming surgical intervention in minors is insufficient for us to make a definitive statement, the AMA agrees with ASPS that surgical interventions in minors should be generally deferred to adulthood. The AMA supports, quote, evidence-based treatment and, quote, including other types of gender-affirming care for minors, the organization added. And that screenshot is part of a tweet that I believe it was Lior Sapir had, in which he says, the American Medical Association agrees with the ASPS about surgeries. If the AMA was wrong about surgeries, could it also have been wrong about hormones? Good question. Of course they are, and as Lior Sapir knows very well, he's on the side of reality and moral rightness in this fight, has been from the beginning. So it's happening. It has felt like it was happening for a long time, and I have been suspicious that there would be clawing back, and it's not over by any means. I guess the other big piece of news, which I actually don't have a screenshot of or a direct reference to, is that the first lawsuit providing basically. I can't think of any legal terms at the moment. Restitution, that's not the right word, to someone who got transitioned because their parents were told that if they didn't, they would commit suicide, has received, I think, $2 million in damages.
Yep.
So all of this is happening, a couple years after we have the Cass report out of England, after so many people have been working so hard at revealing the truth for so long. But frankly, the ASPS, the American Society of Plastic Surgeons, actually coming out with a position statement, weak as it is hugely important. And among other things, the ACLU, among other once important and now deeply corrupt organizations, cannot continue to claim that all of the medical organizations support gender-affirming care, which, by the way, many of us have been objecting to that term gender-affirming care forever. This was, again, mental instability-affirming care at best.
Yes, and I will point out, as we've talked about before, it is actually not just offensive and absurd, but it is linguistically insane. It's as gender denying as it is gender affirming.
Of course.
Right? You're affirming one gender and denying biology while...
denying who you are. Abandoning your own identity in the name of creating identity.
Yeah. So anyway, it was obscene, and I agree with you. Like, I cannot stand the fact that we're going to be mealy-mouthed about reversing our position now.
Well, here's why we only got to it now. In 2024, the evidence wasn't all in, so
we're all really busy. We have lots of stuff on our desk, so we've been maiming children, because this just hadn't gotten to the top of the pile.
It's just what we were doing, and what could you do?
But I want to point out a couple things. One, once again, the institutions are brought to reality kicking and screaming. They can no longer sustain their stupid fiction. And so the public and its understanding is dragging the institutions so that they will finally acknowledge this is the exact inverse of what experts and authorities are supposed to be. It's not supposed to be that we wake up and force the New York Times to report shit. It's supposed to be that they actually have a bunch of people who are trying to figure out what's going on and send them into the field and look.
Right.
We're not supposed to be dragging the, medical societies to the recognition of biology.
Right.
They're supposed to take that on board as part of their mission. So the fact that this is trailing is one thing worth noticing. Once again, the public has woken up to the obvious well ahead of the institutions, and the institutions are only coming around once they can no longer sustain their lies. Mm-hmm. Second thing is, okay, this is the second time that we are seeing this inside of a couple months.
Yep.
Right? Climate. Like, we started turning around on climate because, you know what? The race is on. We're going to need energy for AI now, let's figure out every kind of energy we could have. Oil is good. There's a lot of energy in there. And hey, nuclear, that's pretty fancy. So the point is, well, we can't very well go sustaining our mythology that allowed us to intimidate you and control you and get you to fight each other, because actually we now have a new agenda that is incompatible with the story we've been giving you for decades, right? So there's that too. And then the third thing is, okay, here we're seeing 0 as a special number, right? The fact that
the dominoes will start to fall.
the dominoes are starting to fall, because the last thing you want to do is be the last person on board with the new reality, which is, oh, we were maiming children. We stopped. Hey, we were early.
Yeah.
Right? That's the thing. We were early. We were ahead of the, American.
I mean, we did do it for years.
Right.
And we did know exactly what we were doing, because how could you not? But we stopped. Can't you congratulate us for stopping?
Right. Which
Yes.
also reminds me of COVID. Right.
Oh, yeah.
They were
No,
literally.
this is a kind of middle ground scramble.
This is a middle ground scramble, and they're trying to formulate the position in which, well, now we understand that the data isn't quite as persuasive as we once thought it was about the blah, 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 blah. And the answer is no, you motherfuckers. You were maiming children for money, and you had a cover story, and it was false, and we've been telling you that, and you've been ignoring it, and you're still not owning up to what you did.
And
So-
frankly, your cover story, it was lots of cover stories, and some of them, maybe all of them, were completely despicable. Threatening parents with the idea that their child would commit suicide unless you maimed them? I don't know what's more disgusting to do to a parent.
It's.
I have a choice between, this is what people would say. I could either have, a dead son or a live daughter.
Right.
Or, usually the other way around. But, bullshit. It was always bullshit. And the fact that young people who were confused about their own identity, who were going through the throes of adolescence, as everyone does, in a world where they had been told that they could, and probably they should, they would certainly get a lot more social cachet if they did so, decide that they were the opposite sex. They knew that the magic words to say to their parents in order to get their gender-affirming care, which is to say their mental instability-affirming care, it's actually what it was, Mom, Dad, I'm going to kill myself if you don't let me do this. So this was a disgusting tactic that was created by who knows whom, and then spread like wildfire across a population that was then duly maimed by plastic surgeons, the professional organization of which is finally saying, yeah, actually, maybe wait at least until you're 19, because then at least they get to sign their own paperwork, right? Like there's obviously nothing magical that happens on your 19th birthday.
No, that's probably actually it. The idea is, if you're a kid and somebody coerces your parent into consenting to maiming you, one can imagine the lawsuit in which you say, hey, I had a right not to be maimed and you lied to my parent. Whereas if you sign a bunch of stuff that says there in the fine print, if you know just how to squint at it, well, then the answer is, well, we did tell you that.
Yeah. Even if you got your first cross-sex hormone prescription after a half an hour conversation with a person you'd never met before, which we know happens over and over and over again. And in some cases, we're then directed to the pipeline for surgery, for cross-sex surgery, which isn't a thing, but, gender-destroying surgery right away as well. Well, if you're legally an adult, then it's a kind of liability protection.
Yeah,
Actually,
I think it is. There's a lot to say here, but the fact is they knew. They're not telling us a true story, and it is, it's a ghastly crime against humanity. I wanted to add one thing, which is I just want people to take a moment to put themselves in the shoes of a normal parent who loves their child, finds that their child is troubled, which is very easy to be in a world that makes as little sense as this. And your child is convinced that they might be trans, and the doctor is telling you, well, wouldn't you rather have a live daughter than a dead son? Think about what that does to you. If you're afraid, if you've got a troubled child, you have to be afraid of suicide, right? It happens a lot. So you're thinking, oh, a doctor has just told me that suicide is likely if I don't consent to this. I will literally not be able to live with myself if I say no, even if I think that's the right thing to do for my child. That's my instinct. I'm not an expert. And what if I say no and then the worst happens, which it might?
How will I live with myself?
How will I live with myself? So the answer is you default into
Whatever intervention you say,
right,
Doug.
at least I've done what I can. And the point is actually what you did is consent to have a doctor maim your child. And it is your job not to do that. But it is also understandable how experts who represent themselves as knowing something about your child's mind and what might help it can trick people into doing this.
Yes.
I mean, they're destroying people and families. And anyway, I think it makes sense to just spend a minute in those parents' shoes because it is not a comfortable place to be.
No, not at all.